There's some people that say, how can you talk about it? You know, it's how could you do the podcast? How could you fight to get the memorial at the park? And I say, how could I not? You know, we're not all made up the same way. And sure, people might want to say, well, you're just an angry mother. But I'd say, why wouldn't I be angry after what we lived? But that's not what this is about. It's not about anger. It's about change. My name is Marianne Sinisi, and this is my advice. My story is about my son that we lost in 2018 to substance use disorder. And so I started a group called Families United for Change so that I could help others that are suffering and help the parents, siblings, family members, loved ones, to come to terms with not only what they have to live with the person, but what the system seems to throw in their direction while they're trying to recover. It's really a journey that nobody wants to take. No one starts out saying, I want to become addicted to a substance and I'm going to go down this path. Whether it's someone who starts out from, like, in a social situation, that's not the case, that they want that in their life. There's many people, in my opinion, the majority of people that do experiment with substance are people that suffer some sort of trauma or something in their life that is too difficult to handle and they don't know how to handle, so they end up trying to numb away whatever those feelings are, whether it's hatred of themselves or just depression, trauma, again, like I said, that happens in maybe childhood. And no two people in the same family even are the same, whereas somebody that survived a divorce maybe of their parents, one child could be fine, but the other child could take that so differently and so personal. Even though it wasn't meant that way, and maybe the parents did everything the right way with their children, it's their interpretation that matters and how they feel. So for them, they may go down this path of self-numbing, and the parents may not even see what's happening, until they're deep into addiction, which for us, we did notice behavior changes in our son, probably late teens, I guess it started. But of course, as a parent, you just kind of think that's normal, that's puberty, that's growing, that's, he'll get over it, these behaviors are just typical. But they aren't typical. And the more extreme the behaviors become, the more the parent really should be watching and monitoring and not just saying they'll grow out of it. Because in our case, our child was sexually abused by somebody, but we didn't know that until later. And he wouldn't talk about it. So for us, that was really difficult to try to manage the system once he started getting in trouble and being a part of the criminal justice system. They are in control then of everything that happens to that person, not you. But if you're working with experts who, psychologists or anyone that works in the drug addiction field, would also be, you need to get to the root of the problem. That's why they're using a substance. But the system doesn't care. So you're kind of stuck really in between both worlds. And for us, as much as we tried to make the system aware that this probably was an issue for our child, they really didn't want to hear it. And it doesn't matter because you're just a number in that system. Another hurdle for them for this disease is that they are treated so differently as far as the shame and the stigma. If you have cancer or heart disease or diabetes, nobody is shaming you for that disease. Even if you were a smoker and you end up with lung cancer, you are treated in a different way than somebody that suffers from substance use disorder. You can get your treatment. They don't put a limitation on it and say you get 30 days of treatment, that's it. And then you go back out there and you just function or survive. Whereas that is the case. Insurance companies will decide sometimes how long you get. The facility themselves could decide how long and what type of treatment is best for you within a 30-day period or a 2-week period. And that to me is something that for him, for Shawn, was impossible, because there's no way that somebody that had such deep trauma in 2 weeks' time, that we had the magic remedy to fix the deep pain that he suffered. Nobody that comes into a room and talks to him for 15 minutes is able to find the answer that's going to help him. He should have had long-term treatment so that he could work on not just the substance use, but the trauma that was so deeply embedded. And that's not something that you're going to do in 30, I wouldn't even say for Shawn, as deep as it was and as horrible of the drugs that he was involved with at the end, I think he could have used a year, really, to really dig deep and to get himself into a better headspace. The court systems still want to fight and say that if you're on a medically assisted treatment program, that they really don't want you in drug court or DUI court. And that to me, again, is wrong, because if you had cancer, that wouldn't be the case. So for some reason, I just feel like we're so behind in this country more than other countries are as far as treating the people that suffer from substance use disorder. And I come across a lot of people that will come to me and ask, well, what would you do if your child's doing this or they're doing that? And I'd say, above all else, drop the tough love. Do not use tough love, because I can guarantee you, if you know your child, then you know that they don't want to be doing what they're doing. It is not them. It is the drug. So until you can get them to a better place of sobriety, then I would say just keep loving them. Of course, don't, be taken advantage of. I would never recommend that. But there are ways to find things to do to show them that you still love them, instead of lectures and threatening. And obviously the idea of treatment needs to be theirs. But I just think, how's anybody going to want it if you're lecturing and browbeating and belittling them? It really doesn't do anything for their self-esteem, because there is so much shame and guilt. And that's kind of the way that society has set it up. So I have looked at it, even with my son, we used to talk, and I'd tell him he was such a sweet, loving person that he would give anything to anybody if he could. And so when he would have times of sobriety and clear head, I would always say, you're just so charismatic and so loving that you could be a part of the change someday. You can be what it's going to take to show people that you do deserve to be treated just like anybody else that has a disease. And once you start showing people that suffer like you do that they also deserve it, that's a movement. And that's when it starts to change, that people will realize that they do deserve better. You know your child better than anyone, and your child is in there. It's just the drug or the alcohol that has taken control. So when I'd have some say, well, it's just so hard because they fight with me all the time, and I ended up making up this little thing that when I looked at him when he fought with me like that, and I knew it wasn't him, I would just picture a bottle of pills in front of me, or a needle, a bottle of alcohol, and that would make me see him trapped inside of that item. And I could rationalize better in my own head. I know that might sound crazy, but it worked for me. So sometimes I tell parents to try that. But again, always say, no matter how angry they are, just say you love them and that you only want the best and that you're there for them to help them steer and maneuver the system, because again, it's a hard system to go through, and I feel terrible for anyone that has no support and no one to help. A lot of times I will get calls and people will say, I just came out and I have nowhere to go. My family doesn't want me back. Where do I go? And I really don't have a whole lot of advice for them because there really isn't anything out there. You could end up in a sober home or something that's paid for, but where do you have the money? How do you start that? I mean, there's been times where that's exactly what would happen. You know, he could go to one, and if it wasn't paid for by the insurance companies, he'd say, well, I'm court ordered to go there. How do I pay for it? And they would just say, well, get a job. But how do you get a job when you don't have a car and, you know, who's going to hire you? It's just this never-ending vicious cycle, I think, in substance use. And I just keep trying to find ways to show people that these are human beings, and you can't keep holding somebody's head underwater for mistakes that were made, especially when they make those mistakes when the substance is in use. You know, it's not that person. So we're constantly making a decision about that person for a mistake that they made while they were using. And who wants to hear the mistakes repeatedly that they have made in their life over and over? I don't know anybody, whether they suffer from substance use or not, they don't want to keep hearing it. They're going to walk away. But someone who's forced into a system really can't walk away. If they have a horrible situation where they're at, whether it's court ordered, it doesn't matter. They're told to just suck it up and deal because this was something they brought on themselves. I've always struggled with that because I think it is a disease, and it's been proven to be a disease. So why are we saying you brought this on yourself? Until we change that viewpoint in our communities and start having some empathy and love towards people that need it the most, then we are going to keep losing. I mean, we've lost over 108,000, and the numbers are not going down. They're going up. I don't know any other disease that we punish and try to lock behind bars. So that certainly isn't a solution either. If anything, it's been more of a problem because you take somebody that's suffering from a disease and you lock them up. That's traumatizing. If you have a loved one that just decided to experiment, maybe at a party or whatnot, and then they became hooked, or they were prescribed something and they became addicted. If they didn't have trauma in their life before, I can guarantee you by the time they're done, there's going to be trauma involved in their life because it's very traumatic every step of the way for everybody involved in this. My advice, I guess, now for a parent is do just like we did and try to make it out, you know, apparent to the system. Try to get them all the extra help that you can through professionals on your own. A lot of times now the system will try to work with you if you can provide help because they don't want to pay for it. So if you can do any of that on your own, that's great, but going through that and trying to find the right place for your child or your loved one is also another landmine, really, for a parent. There's been a lot of changes in the last few years that there are some different places out there that you can network to see whether they provide the type of treatment that your loved one really could use more of, if it's the trauma. And a lot of the facilities just are strictly abstinence-based. And I guess in the beginning, that's what we thought was the way to go. So we did follow with the advice that was given, which was abstinence-based only. But in hindsight now, looking at that, I think that was probably one of our biggest mistakes because there is no one-size-fits-all. for somebody. Like I said, when you have two children that can view the same thing that happened in two different ways, or you have a patient that has cancer and one will react differently to one treatment versus another, this is really the same thing. I mean, none of us are going to view the same thing the same way. So for us, I think I would have to say, fight the system if you can. Find something that is going to work for your child or your loved one. Don't say that it has to be abstinence-based, because really the drugs that are out there, and since the pharmaceutical companies have done so much damage to our country with the prescribed medications, it's not the same answer. And abstinence-based is not going to be something that they can't just do it, just pull away from that substance. So they may need, medication to help them get to a better place. Above all else, drop the tough love. Do not use tough love, because I can guarantee you, if you know your child, then you know that they don't want to be doing what they're doing. It is not them, it is the drug. So until you can get them to a better place of sobriety, then I would say just keep loving them